artificial ventilation, and obstruction airway emergencies.
Hi guys, have you ever heard about respiratory distress? Respiratory distress is an abnormal condition of our breathing where breathing is noise, snores, or unusually fast or slow, or it can be both. Commonly, the cause of respiratory distress is because of injury, asthma, hyperventilation, and anaphylactic shock. There are a few of symptoms and signs of respiratory distress, which is pain in the chest, dizziness, abnormal breathing patterns, abnormal in skin color. Respiratory distress is a beginning of life-threatening emergency. So when a person is attacked by respiratory distress, we need to give them a basic life support, or we know as BLS. Basically, basic life support or BLS described as first aid procedure to sustain life in an emergency situation. So basically, there are 3 steps in basic life support, which is first, assess the victim, second, open the airway, and third, provide rescue breathing.
There are a few ways to positioning the victim and opening the airway. The first one is head tilt or chin lift maneuver. Second, jaw thrust maneuver. And if the victim is breathing adequately, maintain an open airway and place the victim in the recovery position.
This is the situation where the victim is collapsed because her breathing areas has been blocked.
To place the victim in the recovery position, roll her or him onto the one side, moving head, shoulders, and torso simultaneously without twisting. Then, flex one leg at the knee, place the bottom arm behind the back, and then flex the top arm, placing the hand under the cheek.
Other than compression, rescue breathing is also one of the type of first aid, usually young patients and drowning people. Rescue breathing can be as part of cardiopulmonary resuscitation (CPR). When you see a person collapse and in unconscious, firstly check their breathing. If they are not breathing, check the pulse, here or here. If the pulse is there, means it requires rescue breathing. How to do rescue breathing? There are 2 types of rescue breathing, mouth-to-mouth ventilation and mouth-to-barrier ventilation. Let's start with mouth-to-mouth ventilation. First, keep the victim in a supine position, and then check for the pulse, and then lift the chin to make sure the air is not obstructed. And then, check for the breathing if there is any. If the victim failed to breathe, begin the rescue breathing. Blow air into the victim's mouth with 2 initial breaths, and then check the pulse again and the chest if it is moving. Continue to do the rescue breathing till the victim is breathing normally. And then, let's move to mouth-to-barrier ventilation. Mouth-to-barrier ventilation is just as same as mouth-to-mouth ventilation, but with barrier device. This is to make sure there is no disease transmitted from victim to the first aider or vice versa. The step is the same, but before you blow the air into the victim, place the barrier device, which is look like this, into the victim nose or mouth. Make sure it is airtight sealed, and through the device you can blow the air into the victim's mouth and continue to do the step as same as the step for mouth-to-mouth ventilation.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Amir binti Muhammad Salim.
I want to talk about when you need to do mouth-to-nose ventilation. Firstly, when you can open the victim's mouth. Secondly, the victim's mouth is so large that you can seal it off with your mouth. And thirdly, the victim has no teeth which interfere with the formation of a good seal. And lastly, the victim has mouth injuries. This is how to do mouth-to-nose ventilation. With one hand, tilt the victim's forehead back. With your other hand, lift the lower jaw forward and seal the lips. If you use the jaw thrust maneuver to open the airway, keep the jaw in place with your hand and seal the victim's mouth with your chin. Then, take a breath, then place your mouth over the victim's nose, forming a tight seal and slowly and evenly through a victim's nose. If you can hold the victim's mouth open during the exhalation, the victim will exhale more fully, emptying the lung if the mouth is open. Next, obstructed airway emergencies. The most common cause of respiratory emergency is upper airway obstruction, a foreign object blocking the nose, back of the mouth, or area around the larynx. The most common upper airway obstruction in an unconscious victim is the tongue. The upper airway can also be blocked by food, small objects, or fluids, including saliva, mucus, blood, or vomitus. Sign of complete airway obstruction. First one is inability to speak, groan, cough, or cry out. The victim of a heart attack or other emergency will be able to at least whisper. Then, absence of breath sound and unresponsiveness. Next, labor use of muscle required breath, flare, nostril, syrinx, and facial muscle. Lastly, progressive restless anxiety and confusion. Next is the video of inability to speak, groan, cough, or cry out.
So we go to obstructed airway emergencies. The most common upper airway obstruction in an unconscious victim is the tongue. The upper airway canal so be blocked by food, small objects, or fluids, including saliva, mucus, blood, or vomitus. Next, an obstruction can be partial or complete. Firstly, in a partially obstructed airway with good air exchange, the person can make sound, speak, and cough, indicating a mild blockage with good airflow. Second, if the airway is partially obstructed with poor air exchange, the person can't speak and may wheeze or cough weakly, suggesting a more serious blockage with compromised airflow. Third, in a complete obstructed airway, the person can't make any sounds, signaling a critical situation where immediate intervention is needed. There are two ways to help conscious victims, which are back blows and abnormal thrust.
First way is back blow.
Support the patient's chest with one hand and lead them forward. This may dislodge the foreign body. After each, check whether the obstruction has been dislodged. Second is abnormal thrust. Place a clenched fist between the patient's umbilicus and the ribcage and clasp it with the other hand. Deliver up to 5 sharp thrusts to the abdomen, inwards and upwards. Now we move to the victim who is pregnant, woman, or obese person. First, stand behind the victim with your arms directly under the victim's armpits. Wrap your arms around the victim's chest. Second, position the thumb side of your fist on the middle of the breastbone. Be sure you are on the breastbone, not the ribs. 3. Grab your fist firmly with your other hand and thrust backward sharply. 4. Alternate chest thrust with back blows for the conscious victim.